Healthcare givers to refer any patient with the coronavirus disease to the Center for Disease Control.
I thank our health workers for their commitment, hard work, and sacrifice in the response to this pandemic that has drastically changed the pace and style of life. Through training, provision of guidelines, and personal protective equipment, we continue to enhance the understanding and capacity of our frontline workers for this novel disease.
Minister of Foreign Affairs and that of Aviation gave an update on Nigerians stranded outside the country as well as flight movement during the lockdown period.
We also have had 67 Nigerians, including children, men and women. They were in Côte d'Ivoire. And so we needed to engage with the governments of Togo and the government of Benin for them to be able to go through. And they are now at the Nigerian border, and we got the authorization for them to come into the country. And they will be in isolation for the mandatory 14 days once they have come in.
Not able in the Ministry of Civil Aviation to give blanket approvals for flights in and out of the country. You must specify which flight, for which purpose, from which airport, at what time, if it is cargo, what is the content of the cargo you are bringing in, and all other protocols established by Ministry of Health must be observed.
The Central Task Force will continue to evaluate the impact of the restriction order to curtail the spread of COVID-19 and will appropriately advise the President on the next step to take in the coming days. The coronavirus pandemic has not only forced countries to reorganize their healthcare priorities, but also compelled economic team of nations to go back to the drawing board. Nigeria's Minister of Finance, Zainab Ahmed, and other key officials of the Presidential Economic Team briefed the leadership of the National Assembly on plans to adjust the 2020 financial legislations and budget and COVID-19 interventions. National Assembly correspondent Ignatius reports.
This is the third visit by the Minister of Finance, Zainab Ahmed, to the National Assembly within 4 weeks of the outbreak of the coronavirus in Nigeria. While medics are busy battling the coronavirus at healthcare facilities, the National Assembly and various government ministries are putting heads together to ensure adequate provision of logistics and measures that will cushion the effect of the virus on Nigeria's economy. President of the Senate, Ahmed Lawan, pointed out the need for federal government ministries to streamline their COVID-19 interventions to avoid duplication.
But we also must ensure there is equity, that there is fairness in the distribution or in the interventions. Every part of this country should have something to ameliorate the situation. And that's the issue of electricity. I'm looking forward to a package, a robust package, that will include succor to the Nigerian people on the issue of electricity for 2 months.
Minister of Finance, Zainab Ahmed, accompanied by the Governor of Central Bank of Nigeria, Minister of State for Petroleum Resources, and the Director General of Budget Office, explained that while the process of adjusting the medium-term expenditure framework and the 2020 budget is in motion, the economic team at the moment is preoccupied with designing the programs that will come under the 500 billion naira COVID-19 Crisis Intervention Fund.
As we design the various programs, which will include healthcare, upgrade of healthcare facilities, support to state, public works, and other interventions that we're taking your input from at this time.
This is coming less than 24 hours after a similar meeting involving the legislators and the Minister of Humanitarian Affairs, Disaster Management and Social Development. From the National Assembly, Ignatius NTA News.
The Minister of the Federal Capital Territory, Malam Muhammad Musa Bello, has disclosed that more than 150 hospital beds have been installed and protective kits supplied at the Idu Isolation Center as part of efforts to contain the dreaded COVID-19. At an inspection visit to the center, the minister described the effort as a reflection of partnership. Ifeanyi Izumba was there for NTA News.
Polaris Bank, Faith Foundation, CCECC Construction Company are among organizations that contributed to the setting up of the Idu Isolation Center, provided by the Federal Capital Territory Administration as treatment center for COVID-19 cases. FCT Minister Malam Muhammad Musa Bello says the private sector initiative was built under the leadership of a former minister of FCT, Modibo Ali Umar, whose collective effort complemented that of the FCTA.
Our desire is that, in spite of all the arrangements made, no patient should even arise. We have to really appreciate and follow all the instructions given by our medical personnel regarding social distancing, regarding personal hygiene, regarding constant washing and washing of hands using soap.
The minister inspected the level of work done at Access Road to Gozadam site at Asokoro District Hospital. The medical director, Afioma Uche, said they have worked hard to ensure that facilities will be available for admission of COVID-19 patients. She also emphasized that non-coronavirus patients in the hospital are safe.
By Friday, by the grace of God, and all necessary strategies, equipment, and coordination has been put in place for that purpose.
The FCT administration commended the management team of Asokoro District Hospital for doing a tremendous work and called on all to put in their best, adding that together the nation would defeat the dreaded COVID-19 pandemic. In Abuja, Ifeanyi Izumba, NTA News.
Thank you, Ifeanyi. Similarly, the Catholic Bishops' Conference of Nigeria has donated 435 hospitals and clinics belonging to the Catholic Church nationwide to the Presidential Task Force on COVID-19 to help combat the pandemic in the country. Making the donation in Abuja on behalf of the Bishops' Conference, the Catholic Archbishop of Abuja Archdiocese, Archbishop Ignatius Kegama, commended the Presidential Task Force for the steps being taken to curtail further spread of the disease in the country. He pledged full cooperation of the Catholic Church in the fight against COVID-19 in Nigeria. Chairman of the Presidential Task Force and Secretary to the Government of the Federation, Boss Mustafa, expressed appreciation to the Bishops' Conference for making their medical facilities and clinics available to the task force. He said the facilities would assist medical practitioners in their efforts to end the pandemic in the country. The SGF urged other faith-based groups to lend a strong voice to the decisions of government, particularly on restriction of movement, to halt the spread of the pandemic. Meanwhile, the Commissioner for Health in Lagos State, Professor Akin Abayomi, has confirmed the death of a 66-year-old citizen of the United Kingdom as a result of the coronavirus in the state. He says the victim traveled from India via Dubai to Lagos on the 17th of March 2020. Professor Akin Abayomi said that cases of coronavirus increased to 130 in the state, confirming that discharged patients of COVID-19 have fully recovered. This brings the number of discharged patients to 32. And from Lagos to Katsina State, where the government has sealed the Daura Clinic and Medical Center, a private hospital owned by late Dr. Aliyu Yakubu, who died of COVID-19. NTA News gathered that the clinic is where the deceased was staying with his wife and 7 children. Health officials have also collected samples of 13 persons of the deceased's contacts, including his wife and 3 children who were with him before his death. The samples have been forwarded to NCDC Testing Center Abuja for investigation. 3 persons who had direct contact with the late Dr. Aliyu, who died of COVID-19, have presented themselves to the health authority in Daura for further examination. Similarly, health authorities in Katsina State are calling on other people who had contact with the doctor to present themselves for investigation. In another development, a new suspected case of COVID-19 has emerged in Matazu local government area of Katsina State. The Permanent Secretary Ministry of Health, Dr. Kabir Mustafa, confirmed to NTA that a medical team has been dispatched to Matazu to take samples. The suspected patient is already in isolation. Meanwhile, high-tech laboratories with biosafety systems for the testing of the coronavirus are to be established in Akwa Ibom State. The state government has already acquired 2 PCR machines and is expecting more from private donors for the smooth takeoff of the laboratories.
Are to be sited at the upcoming Infectious Disease Hospital, Itumbang, and Ibom Multi-Specialty Hospital, Uyo, Akwa Ibom State, will complement the existing 7 across the country. While the machines are expected to be fixed within the week, the laboratories will start operations soon after NCDC's accreditation.
As I'm talking to you, we have at least 2 PCR machines in our state here that we are going to install. We have already started that process. We also have some donors who have promised us. As a matter of fact, one has promised us that the machine is going to arrive here within the next 2 days. Essentially about 3 of those machines are going to be with us within this week, and I'm sure that barring any mishap, we should be able to start being able to test very soon.
Meanwhile, the contact tracing for a suspected COVID-19 patient who reported to a private hospital in the Akwa Ibom State capital has commenced. An unconfirmed report has it that the patient was whisked away by relatives when the health personnel attempted to notify the COVID-19 surveillance team.
I understand that the relations smuggled the person and ran away. We are going to reach out to that person if that is true. We've made contact with the doctor where the clinic, who had this clinic, but the story that there was a case of corona yesterday has not been confirmed.
While the government and relevant institutions pool efforts to contain the pandemic, everyone is expected to take responsibility for their health. If we must sound it again, wash your hands regularly, practice healthy respiratory lifestyle, and call the doctor when in doubt. In Uyo, Ifoma Ihoji, NTA News.
Thank you, Ifoma. This is the news on NTA International Abuja. It's time for a break. There'll be more news after the timeout.
James, I don't know. You know the answer to your call. This. Hello.
Is this Mr. Peter? I'm calling from the NCDC. Your friend, Mr. James Okripocha, was brought in this morning and tested positive for the coronavirus. He mentioned that he had been in close contact with you.
God forbid bad thing.
Sir, I am not saying that you have the virus, but you have spent some time with him over the past 14 days and it is better if you self-isolate immediately.
I don't know any James at all. Even only James in the Bible that I know as a good Christian.
Sir, he showed us pictures.
Now, wow. If you have come in contact with someone who has tested positive for the coronavirus, self-isolating is key to protecting those around you. Remember, viruses don't move, people do. Stopping the spread is in your hands.
This message is from the Akinfade Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
This is NTA International. Medical protective items worth about $1.5 million have been delivered to Nigeria by the China Civil Engineering Construction Corporation to fight the spread of the coronavirus pandemic. CCECC is delivering about 16 tons of test kits, ventilators, disinfection machines, disposable medical masks, medicines, rubber gloves, protective gowns, goggles. Others include face shields, infrared thermometers, and other critical care items through a chartered flight operated by Air Peace.
In quarantine for 14 days. They knew that before they came, and they have undergone tests before they left their country. Nevertheless, they will be in quarantine for 14 days. Nigeria NCDC has gone to see where they are supposed to be in quarantine and will continue to pay. They are free to pay visits there throughout the 14 days. So that one is taken care of.
The value of the equipment, medical supplies, is around 1.5 million US dollars, and including the other costs like the chartered air flight, it's all around 2 million US dollars.
Since CCECC has a large number of employees in Nigeria, CCECC at its own cost has flown in a 15-member technical team, 12 of whom are experienced medical professionals with expertise in infectious disease, respiratory illness, intensive care, cardiology, neurology, general surgery and anesthesiology. They are also to assist in the capacity building of the Nigerian medical team after 14 days of compulsory quarantine. And as China lifts lockdown order on Wuhan after 3 months, Egypt extends nationwide nighttime curfew. Adebola Brookslyn Sunday gives us this global update.
Thanks for joining me. As at 6:30 p.m. local time, 1,563,157 cases have been recorded, with 84,807 fatality. Meanwhile, the World Health Organization's European office has said, despite seeing positive signs from some countries, it was too early to scale back measures aimed at containing the spread of the new coronavirus. In another development, the head of the European Research Council, Professor Mauro Ferrari, has resigned in protest against the bloc's handling of its coronavirus response. Spokesperson of the Commission says the body regrets the resignation of Professor Ferrari. These times of unprecedented crisis in which the role of the EU research is key. In Spain, the number of daily coronavirus deaths rose for the second time as 757 people died over the past 24 hours. The health ministry says the pace of the proportional daily increase in the death toll slowed down slightly. And British Prime Minister Boris Johnson has spent a second night in intensive care. Report says he is in a stable condition after receiving oxygen supports for COVID-19 complications. In the Middle East, Iran's new coronavirus death toll has climbed to 3,993, with 121 more deaths in the past 24 hours, with the total number of infections in the country risen to 64,586. President Hassan Rouhani has urged the International Monetary Fund to give the country the $5 billion it requested in emergency funding to help Tehran fight the coronavirus outbreak. And in Africa, the COVID-19 surveillance update as at 6:50 p.m. shows that the continent has a total number of 10,252 positive cases spread across 52 countries, with 492 deaths and 989 recoveries. Still in Africa, Egypt's Prime Minister Mustafa Madbouly says the country will extend a nationwide nighttime curfew by 15 days until April 23 to counter the coronavirus spread after Egypt confirmed new 9 deaths from the virus, raising the death toll to 94 and bringing the total number of infected cases to 1,450. A ban on travel from Wuhan has been lifted, with the first train leaving the city early on Wednesday morning. The city has been in strict quarantine since the end of January as part of a series of measures to try and curb the spread of the virus. I am Adebola Brookslyn Sunday.
The The import of the lockdown in the Federal Capital Territory seems lost to residents and motorists along the Nyanya-Karshi Road. On Nengie, Fine Face reports that despite a roadblock at the Jikwe axis of the road, many vehicles and pedestrians still troop out for their businesses.
Now, despite the stay-at-home order enforced here in the Federal Capital Territory, motorists and commuters around the Nyanya-Karshi Express Road, especially the Jikwe axis, are still on the road. One lane of the road is still stuck with heavy traffic, motorists trying to get out of the satellite town. Security operatives here try to talk to them to go back, but a lot of them are not heeding the advice and still come out in their numbers. We've seen tricycles, motorcyclists carrying passengers, vehicles conveying passengers from one location to the other, despite the lockdown order put in place by the president of the country. Some of them are forced to turn back, but many others still find their way through the blockade. A remarkable feature of this environment is the fact that some of the drivers even go against the traffic, indifferent to the fact that there are security personnel that can turn them back. From Jikwe, on NTA, Fine Face, NTA News.
Part of the Treasury House Office of the Accountant General of the Federation has been gutted by fire. Mia Ogidi reports that this situation is under control.
Abuja, a city experiencing 14-day lockdown to fight an unseen enemy, coronavirus pandemic. But fire defied this lockdown order and visited the nation's Treasury House, the office of the Accountant General of the Federation. Smoke sighted from afar, announcing the presence of the fire. "25 firefighting trucks arrived swiftly and the smoke ceased.
The fire has been extinguished.
It was the 4th floor of the building, and the Minister of State for Finance gives an assessment.
An officer came to the office. He said he put on the air conditioner and there was a spark, and he noticed smoke, so he immediately put it off, but it was still smoldering, so he had to rush out to get some help. And I'm glad to report to you that our data center, where all our records are kept, they are fully intact. There is no destruction, so we haven't lost any record.
Going to be an investigation to be instituted, and we should allow investigation to say it as it is. It is indeed a sad incident at the Treasury House. But on the other side, it is also a reminder, especially those whose houses and shops and offices are locked down during this period, to ensure that their electronics are also put off. Mia Ogede, NTA News.
And Tokyo 2020 athletics qualifications suspended until December. Kenne Emma Budiki reports.
The Nigeria Olympic Committee (NOC) has applauded the Minister of Youth and Sports